All right, next on the agenda is the lines. These go into a square pump, which I'm going to show you right now, is here. Of course, this square pump needs assistance. Where is it? Anyway, these are really old, but they're wonderful because they do let you program everything in. Channels A, B, and C. You need to set up 4 of these lines. These lines are called mini med tubing. This drip chamber fits right into the syringe, right into here, and we can show each other how to do it. But the most important thing is how many to have in the setup and what needs to be labeled. So you need to have at least 4. Every patient is on Amicar, Presidex, nitroglycerin, and Levophed. Now, they just need a way to get the blood pressure down quick and a way to get the blood pressure up really quick. So those are the 4 things that you won't find anybody who will tell you, other than Dr. Montague, that doesn't want these. But everybody gets these 2 for sure. You're safe with a setup of this. Now, you can also hang cardine, milrinone. You can hang epinephrine. All of these are things that I would just leave for an as-needed basis, and then you can just grab them as you need. But these are the 4 that need to go in what they call the bag. Next, every patient gets 3 lines, right? So, and I mean lines, I mean IVs that you set up in the morning. The first line is blood tubing. It's blood tubing connected to a warmer. Let's get it on here. Connected to a warmer, connected to a small extension, long extension, and then another small extension. So, and this will get hooked up to the fluid warmer in a 1,000 cc normal saline bag. This is called your volume line, and it may help you to label the clamp volume line. Okay, next on the agenda is the second IV, a 500 cc bag of normal saline. Goes to mini tubing, connected to one of these red doohickey ports, connected to long extension, connected to small extension. This is a triple port that Dr. Hello likes to use, Dr. Gerenstein likes to use, Dr. Loskov and Dr. Montague will take it off and tell you not to put it on. I can't speak for any of the other doctors. Brooker doesn't really care for it, but doesn't care either way. He's not very picky. Dr. Hello definitely wants this. Gerenstein definitely wants this. Loskov and Montague, I told them they're going to have to take them off because we'll set them up every time. And they didn't seem to have a complaint. This is your med line. And it would be advantageous to label here in marker Medline. And then to take one of these labels that looks like this and put it somewhere here, because this is going to be to the IJ once you get it, and you need to be able to see what you're doing if you don't have this here. The other final port is called the final IV is called the VIP line. It's a 60 drop mini IV tubing connected to a small port, connected to a 6-way manifold that goes to the patient. Now, all 3 of these are connected to the patient's neck. If anything, this one can go to a peripheral line, but you don't make that decision, they will. But definitely volume and definitely VIP. You're going to go to either a triple lumen, a swan, whatever they have in the patient's right IJ, which is the place of choice for a line. So this 6-port manifold is where all of these are going to get connected into 1, 2, 3, 4, 5, 6 as you're handing out, putting meds up. And again, this is called the VIP line, and it goes to the patient. Central line for meds. This is also a 500 cc normal saline bag. So 500 cc normal saline bag, 500 cc normal saline bag, 1 liter bag to blood tubing, and then your 4 things. Now all of those are going to go into a bag. All of this here is the clean syringes that I just piled up. All of this is going to go into the bag and dated and then timed and then thrown into the cabinet for use for tomorrow. It'll help you in the morning. And this is called, when they ask you to make up a bag, this is making up a bag.